Okay, so my subject is tricuspid atresia. Tricuspid atresia is a congenital heart disease that is seen at birth, in which the tricuspid heart valve is missing or abnormally developed. This heart defect blocks blood flow from the right atrium to the right ventricle. Um, it is very uncommon. It's a very uncommon congenital heart disease that affects only one in about 100,000 live births. So what's happening in the heart, typically, as we know, the blood flows from the right atrium through, and this is just summarized, the blood flows from the right atrium through to the tricuspid valve, next to the right ventricle, then, up to the lungs and all the above. But with tricuspid atresia, the blood only flows from the right atrium over to the left atrium, which you can kind of see in this picture over here is showing you there's a little hole right here uh, of the blood flow and how it's going up like that. Blood can also pass through the ductus arteriosus, which connects the pulmonary artery to the aorta. This is the ductus arteriosus is present at birth, but it normally closes after birth. Who is at risk? The CDC says that this congenital heart disease is kind of unknown who is higher at risk, but I did read somewhere that moms, sometimes they think that moms that are on certain medications, they didn't really give specific medications on the articles that I've seen of what medications, but those medications can cause the tricuspid atresia. Diagnosis. Some diagnostic tools that they use are the routine prenatal ultrasounds, ECGs, and echocardiograms, and chest x-rays, MRI of the heart, and CT scan of the heart. So babies born with tricuspid atresia will show symptoms at birth or very soon after birth that they may have the grayish skin color, which is significant for or signs of cyanosis. It's due to their blood not being carrying enough oxygen. Some additional symptoms would be the problems breathing, fatigue, extreme sleepiness. Medical management would be they give the prostaglandin E1 to the babies so that the ductus arteriosus can remain open so that they can have some form of blood flow and it's just not backing up into the lungs. They also, read that on the Boston, was it Boston Children's Hospital? Yeah, Boston Children's Hospital, they said that they give IV fluids and oxygen, but surgery is ultimately the best treatment for these patients. The surgical procedures that they undergo are the um, septostomy, banding, the shunt procedure, and bidirectional Glenn procedure, and Fontan procedure. Bye-bye. Prognosis is surgically. Once they have surgery, they're typically their condition improves. So nursing diagnoses are just a couple would be the decreased cardiac output, activity intolerance, and risk for infection. And nursing interventions would be note the skin color, temperature, and moisture, which you know that their skin color will be the ashen color or blue because they're not getting enough oxygen. Assess the heart rate and blood pressure. You want to position the child in semi-fowlers, which it'll be kind of difficult to position an infant in semi-fowlers, but I'm sure they have their ways of propping them up. Also, you want to administer oxygen as prescribed and avoid allowing the infant to cry for long periods of time.